The group about the non-services to 3.1 million Indians. That's the trust responsibility of the government that they're not receiving last year out of the 4 million Indians. And our question is, the United States government has a trust responsibility by treaty to furnish health care to all Native Americans regardless of their residency. Because the Native Americans have prepaid for the government services, how will the Native Americans be given equal access and quality medical services without cost and regardless of domicile?
Well, what we've done in the legislation, of course, all Native Americans, as all Americans, would be eligible for the expansion of coverage in Medicaid, would be eligible for the refundable tax credits, advanced refundable tax credits that are available through the exchanges, so that if they had an income of 300% of poverty, in the case of the bill we're looking at in finance, or less than 400% of poverty, as is the case in the health and education bill, they would be eligible for those subsidies. In addition, we made provision that there would not be a penalty assessed against any Native American for failure to obtain coverage if they chose not to. And in addition, we are maintaining and hopefully increasing funding for the Indian Health Service. So that's, now I recognize the Indian Health Service doesn't provide adequate services for all Native Americans, particularly once they leave the reservation. So I think that Native Americans, once they leave the reservation, should have access to Indian health care services, as they have to some extent in the past. And I hope that that could be increased.
Thank you, sir. Let's hear from Group 6.
Good afternoon, Senator. My name is James Harris. You touched on this earlier, but our group's question is, in light of the current budget deficit and rising cost of health care, how does the government propose to pay for this health care reform?
No, that's a very relevant question, and the expectation is that we would do 2 things. We would find savings in other government expenditures on health care, and a significant amount of those savings are going to be required at any rate in order to keep Medicare from becoming insolvent in the next 8 to 10 years. And so that's increased efficiencies in the delivery of care through Medicare. We're also looking at raising some revenue from other measures. I think the largest single one would be to put a tax on insurance companies issuing policies that have a value above a certain amount. Now, to give you some more precision on what we're talking about, the average family policy in New Mexico at the current time costs about $11,500 for the premium to insure your family for a year. What we're saying is that if a company issues a policy that is worth more than $22,000 in premiums, costs more than $22,000 in premiums, or $25,000, and we haven't settled on exactly the right figure, that the amount of that policy above that $22,000 or above that $25,000 would be subject to an excise tax. And that would discourage companies from issuing that kind of Cadillac plan, which the Congressional Budget Office tells us is a significant, the issuance of those plans is a significant contributor to the overutilization of healthcare services, which continues to drive up the cost of healthcare. So we both raise some revenue to pay for the expanded coverage in the bill, and we hopefully begin to bend the cost curve down, as the economists tell us, in the overall cost of health care in our society.